Hey, what's up guys? Today we're going to be talking about anatomic positioning, and it's a part of our medical lingo series in which we talk to you guys about things that you have to know before taking anatomy. So this is our anatomic position, and look at how his hands are formed. And I usually like to draw out the planes, but I don't want to confuse you guys too much right now. So our first word is superior, cephalic, or cranial, and its opposite is inferior or caudal. And this is our relation towards the skull. So superior is towards the skull, inferior is away from the skull. All right. And it all has to do with our reference point. So the ankle is our reference point, and that is inferior to that of our hand, but it's going to be superior to our toes, our foot in general. So the ankle is inferior to that of the hand, but superior to that of our toes. Okay, our next words are anterior, which is synonymous to ventral, or posterior, which is opposite of anterior, and dorsal. So anterior is going to be front of the body, and then posterior is going to be the back of the body. And it's in relation to what? So in relation to my eyes, my nose is anterior to that of my eyes, and my ear is posterior to that of my eyes. So it's in relation to what? Proximal is closer to that object or that landmark, and then distal is further away or further away from it, okay? And that sounds kind of confusing, but think of our skull as our starting point, okay? So proximal, and I'm about to give an example, but proximal is closer, and then distal, think of distal as distance away from the object. So let's say our reference point is our knee or our patella. Our femur, which is the large bone I outlined in blue, is more proximal to that of our knee, but our tibia, which is the one in red, is more distal to that of our knee. So once again, it's the relation to what is our starting point. All right, so the knee, once again, the patella, our femur in blue is proximal, and then in red is distal. All right, we have medial and lateral. So think of medial and lateral, and I drew a line across. I drew one of our planes across. And think of it as closer to the midline or core, and then lateral is further away from that midline. All right, so I'm going to draw here, I'm going to outline the ribs, and the ribs are more medial to the core or to that spine than that of our humerus or our big arm bone. Okay, so the humerus is lateral to the ribs, and then the ribs are medial to that of our humerus. All right. Ipsilateral is the same side, and then contralateral is the opposing side. And then this is more important in neuro, because if you talk about lacerated nerves, you want to know if it's affecting the same side of the body or contralateral side. Intermediate is kind of self-explanatory, so it's intermediate to that of objects. So the pelvis is intermediate to the femurs, so the legs sit on opposing sides of that middle object. So intermediate is in between or in the middle of. Superficial is closer to the surface or the skin, and then deep is closer to the bones I put, but however, it's in relation to what? So it's closer to the core. So in red is going to be deep to that of the blue, but if I were talking about bones per se, the bones are more superficial than our organs, such as the heart or the lungs, because they are more external, they're more superficial. Adduct and abduct, those are our first action words that we're going to learn. So adduct is bringing something closer to our core. Abduct is bringing our arm outwards away from our core. So we're going to cover more of these action words in our next video of medical lingo, and these are must know for all anatomy and what we need to know going forward. Okay, thank you guys.